Hi, I'm Dr. Sebastian Gonzalez with Performance Place Sports Care again. Again, we're doing a series of videos on different types of research studies we get. So this is one that I actually had for a little while, and it is called Exercise Verse. Actually, I'll bring it to the camera again, just like always, because I am a little too lazy to probably write these out. So it is called Exercise Verse Arthroscopic Decompression in Patients with Subacromial Impingement, a randomized control study of 90 cases within a 1-year follow-up. So what does that mean? It's actually subacromial impingement. If you have not heard of that condition, it's basically kind of that pinching pain that a lot of people feel in the shoulder. I would say it's super common in regards to the reasons why we see people, at least in this office, and it's a very common sports injury. It's probably one that is right up there around, if you search knee stuff and you're a runner, you'll probably get IT band pain all over the place. This is probably something you'll get when you research shoulder conditions. So this study was actually in 2004, and I'll just read off of this as always, just a few things. So the diagnostic criteria for this, it was the presence of shoulder pain, pain with abduction of the shoulder within a painful arc, a positive impingement sign, which is also called Hawkins sign, you can look that up, and a positive impingement test, that relief of pain within 15 minutes after a local injection within the area. So subacromial impingement, I'll do a rough overview of what it is again in case you don't know. Consider your humeral head, which is right there, and here is the acromion, and here's the subacromial space. Within there is a bursa, there's tendons, and so on, and if that thing gets compressed for whatever reason, whether the bone being growing downward, or the acromion hooking, or this riding high, or something in it expanding, it can feel impinged, and that's a very general term of the condition anyways. So also these people had to have normal passive range of motion, which means that we can move the arm. So if someone came up and moved my arm, the range of motion would be normal, which we're kind of ruling out things which are joint deformities and so on, possibly frozen shoulder. But here's the reason why I thought this study was interesting, was because it was comparing physical therapy, actually not physical therapy, they said physiotherapy, with decompression surgery, which both are very commonly used protocols for this type of condition. Now a lot of people are very scared of surgeries, and rightly so, but also too, there's a lot of people that don't take the rehab seriously as well. So you should know that if you are going to do rehab on an area, you need to take it seriously. You need to do it the amount of times that your therapist or doc or chiropractor or strength coach recommend. They're recommending it mainly because of these guidelines. These are the people which improve with therapy, but a lot of times when we have cases where people don't show up again, we consider them dropout. And in this study, actually, there was 90 people that came into the study again. There was a few dropouts, and they said that there was 4 cases of dropout, and this from the dropout before the start of the study. One was because of work problems, one because of a tumor. The other one, his wife actually advised against it. It's kind of funny. The other one's an unknown reason. But a lot of times you can't get consistent findings with improvements with rehab if you don't have consistency of care. Now, I'm not going to drag this on too long because I know that you want to know which one is better. And actually they found that they were actually pretty close. So the conclusion of the abstract, it says the surgical treatment of the rotator cuff syndrome with subacromial impingement was not superior to physical therapy with training. Further studies are needed to qualify treatment choice decisions. Another part of the conclusion basically said, patients who did not improve within 6 months of a supervised exercise regimen should be evaluated for surgery. So they found we are now more reluctant to recommend surgeries in cases with stage 2 impingement. So again, I'll bring this up here so you guys can see the study. This is from 2004 again. Feel free to type this in on Google and read it all yourself. But I think it's a very clear picture of the fact that you don't always need surgery to improve conditions, but a lot of times conditions can improve with surgery. So I know it seems very vague, but at the same time, it's important to talk to your sports care doc, talk to your healthcare provider, your physical therapist, your strength coach, and see their experience in working with these types of conditions. Because I know when someone comes in to see me, I can look at them within a few minutes and be able to tell whether I think it might be a productive case or not. There's other people on the flip side where they come in and things look very dismal for their improvement, and I usually recommend them to go on further to somebody else, to a specialist. So hope this was helpful. Again, I'm not intended to send too many of my opinions or skewed opinions on with this study, but these are mainly the facts. This is the facts that this study showed. So I'm sure there's other studies which can conflict as well. This one is a little bit of an older study. I recognize that, but I still think it was an interesting one. So if you guys have any questions or comments for me, feel free to contact us on the website. It's p2sportscare.com. Again, anything constructive criticism only, or support. I usually don't respond to negative comments in case I do get any. Very rare, but I do get some. So take care, guys. I hope this was educational.